You have a 50-year-old male complaining of chest pain.
Okay, BSI seen safe.
Scene is safe.
Okay, is there any environmental hazards?
No environmental hazards.
Number of patients?
1.
Do I have additional resources?
No.
What is the mechanism of injury or nature of illness?
Chest pain.
Okay, is there a need for extrication?
No need for extrication.
And is there a need for spinal immobilization?
No need for spinal immobilization.
Okay, I will check the patient's alertness. Hello, sir. My name is Gabriel. Can I help you?
Yes, please.
Okay, the patient is alert on the AFPU scale. Are there any immediate life threats?
No.
Okay, is his airway open?
Airway is open and patent.
Okay, I will then assess his breathing. He's breathing unlabored, unlabored with equal rise and fall of the chest at 12 to 20 breaths per minute range, so he's breathing good. I will then place a pulse oximeter on his finger to get a reading. Okay, it reads 88%, so I will then supply supplemental oxygen using a non-rebreather mask at 15 liters per minute, so place that on. Okay, I will then move on to circulation. Is there any major bleeding?
No.
No? Okay. I will then move on to skin signs. His skin is warm, dry, and of normal color. And then I will assess his pulse rate. Okay, he had 94 beats per minute. I would make him a high priority and initiate transportation because of his pulse oximeter reading of 88%. I will then move on to my OPQRST assessment. So, sir, for this pain, how is it? Is it onset? Is it acute or is it chronic? Like, is it sudden or ongoing?
It was very sudden.
Very sudden. Okay. Can you point to it?
Yeah, it's right here in my chest.
Okay. If I push down on it, does that it hurt anymore? Or?
No.
No. Okay. Does anything make it feel better or worse?
Standing up makes it feel worse.
Standing up makes it feel worse. Okay. How would you rate? Does this pain radiate
Yes, down my arm.
down your arm? Okay. On a scale of 0 through 10, 10 being the worst pain you felt, how does the pain feel like?
About a 7.
About a 7. Okay. And how would you describe this pain feeling? What quality?
Just pressure.
Pressure. Okay. And how long has it been happening?
About the last hour.
Last hour. Okay. Do you have any allergies to any medication or food?
Penicillin.
Penicillin. Okay. Are you taking any medication right now, either prescribed or over the counter?
Albuterol and Cinepril.
Cinepril. Okay. Do you have any past medical history that you know of?
I have hypertension and asthma.
Hypertension and asthma. Okay. And what was your last oral intake?
I had a Big Mac.
Okay, you had a Big Mac. What was happening on the events leading to?
I was just watching TV.
Just watching TV. Okay. I will then start my focus assessment. I will check his chest for any pain. Do you feel any pain?
No.
No, no pain. Okay. I will then check for his lung sounds. Okay, I will then check his heart sounds. Okay. I will then check his back to see if there's any pain. Do you have any pain back here?
I do not.
No pain? Okay, and I'll check his chest again one more time. Do you have any pain?
I do not.
Okay. I will then assess his vital signs. I will retake his pulse rate. Okay, his pulse was at 96 beats per minute. His skin is dry, normal color, and warm to the touch. His breathing is unlabored, 12 in the 12 to 20 range, 12 to 20 beats per minute range, or breaths per minute range, and with equal rise and fall of the chest. I will then take his blood pressure. Okay, his blood pressure was at 190 over 110. I will recheck his pulse oximeter reading. It is at 98%, so the supplemental oxygen is working. I will then do my head to toe assessment. I will check his scalp for any blood or secretions. There's none. I will then check his ears for any blood or any spinal fluid. There's none. I will check his pupils to see if they're round, full, and responsive to light. They are. I will then check his nose for any nasal flaring. There's none. I will check his lips for any different colors, such as cyanosis. There's none. I will then check his neck for any stomas, JVDs, or medical alert necklaces. There's none. I will check the back of his neck for any pain. Do you feel any pain?
I do not.
Do not? Okay. I will then recheck his chest for any pain. Do you feel any pain?
I do not.
I'll check his back for any pain. Do you feel any pain?
I do not.
Okay. I will then reassess his lung sounds. Okay, his lung sounds still sound good, unlabored. I will then check the 4 quadrants of his abdomen for any pain. Do you feel any pain in any of these?
I do not.
No pain? Okay, I will squeeze his ribs and ask him to breathe in and out. Okay, can you breathe in and out?
Mm-hmm.
Okay. I will then check his pelvis for any pain. Do you feel any pain?
I do not.
No pain? Okay, I will check both of his legs for any pain. You feel any pain?
I do not.
Any pain?
I do not.
Okay. I will then check his legs for any swelling. There's no swelling. I will then check his, ask him to move his, can you wiggle your toes? Okay. Can you push down? Push up? Okay. I will then check his, can I see your hand? I will check his capillary refill. And they're under 2 seconds, so that's good. Can you wiggle your hands? Okay, I'll go. Do this one. Yep, wiggle, yep, and then they're good. Okay, I will continue reassessing him every 5 minutes, and I will continue transportation, and I will transfer any information to the nurse that takes him.